The pandemic has taken a big hit on mental health, including for kids. That's why leading physicians say kids should be screened for anxiety as young as 8 years old. The American Academy of Pediatrics declared a national state of emergency in children's mental health following fallout from the pandemic. New at 5 tonight, Esther Bauer shows us why early intervention is crucial.
Emergency room visits went up 24% in kids 5 to 11 years old. Young kids in this age range may not be able to express their emotions like you and I do. Anxiety could still be present through bursts of rage, complaining about stomach aches or headaches, and not wanting to go to school. These are signs you should look for in your kids as more and more young people are struggling with their mental health.
The need is so great
for children's mental health solutions. The CDC says around 37% of students experienced poor mental health during the pandemic. Today, local school counselors are seeing more young people in need.
I don't think anxiety is going away. I don't think depression is going away. I think that, like what you're talking about now, we're seeing it at younger ages.
To help the issue, the U.S. Preventive Services Task Force is suggesting children between ages 8 and 18 are screened for anxiety. In kids ages 12 to 18, they suggest screening for major depressive disorder and suicide. Sabrina Votava sees the recommendation as a proactive measure. She's a local mental health counselor and mom to young children. She says the earlier young people learn to cope, the better off they'll be.
If we can understand it at an early age, it just sets us up for success for the rest of our life, really.
Successful outcomes, parents help guide.
It's very important for parents to validate kids' feelings, to not just say you're fine or it's going to be okay. So to really empathize.
As a parent, I feel that it's on me to help my kiddos understand that not only is this normal, but there are lots of things that we can do to help navigate that.
So kids can navigate life to the fullest without their mental health holding them back.
And Sabrina says with her young children, she doesn't want to create fear or concern in their lives about mental health. She makes those conversations about stressors and feelings a part of everyday life. So when concerns do arise, that line of communication is already open. Reporting in studio tonight, Esther Bauer, 4 News Now.
Thank you so much for that, Esther.